Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Salmeterol. Its brand name is Serevent. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Salmeterol. We'll then discuss examples of dosing and finish it off with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Salmeterol is a long-acting beta-2 adrenergic receptor agonist. It stimulates adenyl cyclase, resulting in increased intracellular cyclic AMP levels, which in turn triggers bronchial smooth muscle relaxation. In terms of indications or reasons we would prescribe this medication to a patient, well, we may see it used in the treatment of asthma, as well as chronic obstructive pulmonary disease, or COPD. This medication can also be used for exercise-induced asthma. It would be used preventatively or prophylactically. And lastly here, it can be used for nocturnal asthma. With respect to contraindications or reasons we would not be able to prescribe Salmeterol to a patient, well, first of all, we just wouldn't give this medication to a patient who had a hypersensitivity to Salmeterol or any other component of the formulation. As well, if a patient had a severe hypersensitivity to milk proteins, they would also not use Salmeterol. This medication would not be used for treatment of asthma without the use of an inhaled corticosteroid, so they should be used in combination. And it should not be used for primary treatment of status asthmaticus. Now, for examples of dosing with Salmeterol, in the treatment of asthma, we may see 50 micrograms via oral inhalation twice daily, 12 hours apart. And then we use this medication in combination with an inhaled corticosteroid, as mentioned on the previous slide. For exercise-induced asthma, we may see one oral inhalation, or 50 micrograms, 30 minutes before exercise, and then you would wait at least 12 hours before taking another dose. As with all medications, there are some side effects or adverse reactions that patients may experience while using Salmeterol, so we'll go over some of those here now. Musculoskeletal pain may happen 12% of the time, and a headache may happen 13 to 17% of the time. Some more serious side effects would be a prolonged QT interval or a severe exacerbation of asthma. Hey everybody, that's all we're going to talk about today with Salmeterol or Serevent. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.